This is page P1 on the lymphatic system. Now, for probably of all the systems in the entire body, the system that most of us are least familiar with is the lymphatic system. And you will even notice it's not a lot of pages. The lymphatic system is also known as the immune system. And as we know, we're going to focus on the anatomy. And the anatomy, by and large, is pretty simple of the lymphatic system. Functionally, what it does is, as we'll see, it's one of its major roles is this immune response. And where you really focus, the course that really presents the functional parts of the lymphatic or immune system is microbiology. You'll have an entire unit on immunology. And we touch upon it also in physiology, but especially in micro. Now, for those of you who don't have to take micro, so you won't have to worry about it. But for those of you who do, that's really where you learn the cellular, the functional parts of this. All right, so what are the principal functions of the lymphatic system? Number one, the lymphatic system is made up of this whole additional system of lymphatic vessels that conduct, which means carry, the fluid that's squirted out of the bloodstream. These vessels carry that fluid back to the bloodstream. They return it back to the bloodstream, and we're going to see exactly where that occurs. Secondly, there are a number of lymphatic organs, also known as organs of the immune system, and they are involved in destroying bad guys, foreign agents. They filter out and phagocytize, swallow up the bad guys. And thirdly, these lymphatic organs, these organs of the immune system, produce lymphocyte white blood cells. There are really many types of white blood cells, really 5 different categories of white blood cells. All of the white blood cells, just like red blood cells, are made in our bone marrow, with one exception, lymphocyte white blood cells. They are not made in our bone marrow, they are produced in our lymphatic organs. This picture that we see here tries to convey this concept that we have all these lymphatic vessels in our body, and we have a number of lymphatic organs that are scattered all over the place. Of all the systems in our body, the lymphatic system is the system we have just most recently started to understand. In fact, many of these lymphatic organs, like the tonsils and appendix, used to be viewed as having no function at all. They used to remove them because they said you didn't even need them, they didn't do anything. Now we understand better what they do. At the bottom of the page, we wrote here, you have all these lymphatic vessels, these lymphatic capillaries, these small lymphatic vessels. And these lymphatic vessels all join together, they converge, they join together to form 2 major large lymphatic vessels, or ducts. So there is a large right lymphatic duct, sometimes called a thoracic duct, and there's an even larger left lymphatic duct. So all the lymphatic vessels drain into either the right or left lymphatic duct. And what do these 2 large lymphatic ducts do? They connect to the subclavian veins. The right one connects to the right subclavian vein, and the left lymphatic duct connects to the left subclavian vein. The subclavian veins, of course, are right up here in our shoulder, and the subclavian veins, you'll remember, we just attested on it, join with the jugular veins to form brachiocephalic veins that flow into the superior vena cava. So if you're thinking, what? I'll remind you of that. All right, so you'll remember this diagram. So in these lymphatic ducts, we're going to see, we'll show you a picture, they connect to the subclavian veins, and the subclavian veins are bringing the blood to the superior vena cava, to the right atrium. On page P2, we wrote that the right lymphatic duct drains the upper right quadrant of the body, and the larger left lymphatic or thoracic duct drains the remaining 3/4 of the body. To help us understand what we're talking about, let's look on page P3. So on page P3, so we have this picture of a woman, and we get this sense that there's all these lymphatic vessels, and they all flow into a right and left lymphatic duct. And here those two lymphatic ducts are. Now the larger one, the larger of the two, is the left lymphatic duct. And it connects, you can see it right here, it's boxed in, entrance of left lymphatic duct, and it connects to the left subclavian vein, which I've colored in blue. There is a thinner right lymphatic duct that connects to the right subclavian vein. You can see it labeled right here. Now these lymphatic ducts are running right by the vertebral column, so they're deep in our body. So this is where this fluid flows back into the bloodstream. This is where it connects. Now, why is the left lymphatic duct larger than the right one? You know, if I would have figured that if we're going to have a right lymphatic duct and a left one, I would have figured, okay, all the lymphatic vessels on the right half of my body probably should go through the right lymphatic duct and connect to the right subclavian vein. And all of the lymphatic vessels on the left half, they should go through the left lymphatic duct and connect to the left subclavian vein. Is that the way it works? No. The way it works is shown in the picture of the man right here at the right. The reason why the right lymphatic duct is smaller is because only the lymphatic vessels from the upper right quadrant of the body flow into the right lymphatic duct, and from there flow into the right subclavian vein. The reason why the left lymphatic duct is larger than the right is not only do all the lymphatic vessels from the left half of the body, but also the lymphatic vessels from the lower right flow into the larger left lymphatic duct, and then from there into the left subclavian vein. All right, so that's the way it works. You know, is that the way I would have designed the body? No. Now, why is it that way? You know, students will always ask, so why is it that way? So I can give you two answers. One is, God made it that way. That's the way it is. But it's probably commonly a lot of these way things are in the body has to do with embryology and the way they embryologically develop. All right, so you should understand the drainage of the right and left lymphatic vessels. Now, we wrote at the bottom, below the picture, that the lymphatic vessels have very thin walls, and they have valves inside them to prevent backflow. In fact, on the previous page, page P2, on the bottom of P2, so here on the bottom left, it shows a foot, and it tries to convey, we got all these lymphatic vessels. This is in addition to our blood vessels, our blood capillaries. And here it shows an enlarged view, a photomicrograph of a lymphatic vessel showing that there's a valve in them. And we know that valves always ensure one-way flow. That's always the purpose of a valve, to prevent backflow. And we know that when we study blood vessels, well, I'll pose it as a question. Were there valves in the arteries of our body? No, there's no valves in our arteries because there's a very high blood pressure in our arteries. So the blood's not going to reverse direction. It's under a very high pressure. But there are valves in the veins of our body because there's a very low blood pressure in our veins, and when we're standing upright, the pull of gravity pulling our blood down towards our feet is almost a greater pressure than the very low blood pressure in our veins. So what prevents the blood in our veins from going backwards due to gravity is these valves. So the blood in our veins, if it's going to move, has to move in the direction towards our heart. It normally cannot go backwards because of the valves. Well, the reason why there are valves in our lymphatic vessels is they also have a very, very low pressure. It's a very low pressure, and without the valves, the fluid, and there are lymphatic vessels in our legs, the fluid in the lymphatic vessels would flow backwards without those valves. So lymphatic vessels are like veins. In both cases, they have a very low pressure, and they have valves in them to prevent backflow. Okay, so on page P3, we also wrote on page P3 at the bottom, we remind you that there are special lymphatic vessels, lymphatic capillaries, in the villi of our small intestine. And we learned about these. These are called lacteals. And we had learned that the function of the lacteals in the villi is to absorb fats. So fats, fatty acids, cholesterol, fat-soluble vitamins, they are absorbed not into the bloodstream, but into the lymphatic vessels. So now that we're reminding you of that, so there are these lymphatic vessels in the abdominal area. These fats that are absorbed from the digestive tract are going to flow through the left lymphatic duct and then into the left subclavian vein. You'd say, yeah, why do you say the left? Because we know the left lymphatic duct drains the entire abdominal area, right? It drains 3/4 of the body. So all the lymphatic vessels in the abdominal area flow into the larger left lymphatic duct, and from there it flows into the left subclavian vein, and that's when the fats enter our bloodstream. All right? Eventually they will be transported to our liver and to fat cells, but that's just the way fats travel through our body. Remember, in contrast, water-soluble nutrients were absorbed directly into the bloodstream and carried by the hepatic portal vein directly to the liver. On page P4, lymph nodes. Now, lymph nodes, I wrote, are small, round, bean-shaped structures. Inside the lymph nodes are macrophages and lymphocytes. You'd say, what are macrophages? Well, the word macrophage, which we've used previously, literally means big eaters. So these are cells big cells that swallow up, that phagocytize bad guys, foreign agents, viruses, bacteria, and so on. So there are both macrophages and lymphocytes in these lymph nodes. Now, any tissue that contains macrophages and lymphocytes can be referred to as white pulp tissue. White pulp tissue. Now, in fact, what did we say was inside tonsils? What's inside tonsils? Macrophages and lymphocytes. So we could have said that the inside of a tonsil or an appendix is white pulp tissue. Because if it contains macrophages and lymphocytes, it's referred to as this white pulp tissue. Now, lymph nodes are sometimes referred to as lymph glands. Even doctors will say, your glands are swollen. They really should not be called glands. They don't secrete hormones. So they really should be referred to as lymph nodes. And we can speak of enlarged lymph nodes, but we really shouldn't call them glands. Now, where are the lymph nodes in our body? And incidentally, just to look at this picture, so this picture is a lymph node. Inside it would be all these macrophages and lymphocytes. Here it shows a lymphatic vessel, so the fluid would flow through into this lymph node, and then it flows out of the lymph node through this lymphatic vessel. I kind of think of lymph nodes like oil filters in a car. In our car, oil filters filter the oil and remove grit and dirt from the oil. Well, here we've got these lymphatic vessels that are bringing fluid from our body, and this fluid is on its way back into the bloodstream. And before this fluid goes back into the bloodstream, it's forced to flow through a series of lymph nodes that act like oil filters. Inside them are macrophages and lymphocytes to swallow up and destroy any bad guys that might be in that fluid before it empties into our bloodstream. Now we might ask, what is the distribution of lymph nodes in our body? So I made a couple of points here. Number one, we have no lymph nodes in our brain. In other words, there are lymph nodes everywhere in our body except in our brain. All right, that's the only place where we don't have lymph nodes in our body. Okay, they're not in our brain. Now, while there are lymph nodes everywhere else except our brain, there are 5 places in our body where we especially have a lot of lymph nodes. We have a lot of lymph nodes in 5 places. And the 5 places where we especially have a lot of lymph nodes are in the cervical area. And in case you're thinking, what's cervical? That means neck. So we have a lot of lymph nodes, not only in our neck, and I'm sure all of us at one time or another have had a sore throat and felt enlarged lymph nodes in our neck. We have a lot of them in the axillary or armpit area. There are a lot of them in our inguinal. Inguinal means groin, in the groin area. There are also a lot of lymph nodes along the vertebral column. And there are also many, many lymph nodes in the mesenteric area. The mesenteric means intestinal area. After all, we've learned about a superior mesenteric artery and an inferior mesenteric artery, and those were arteries that supplied the intestines. So that's what mesenteric means. Now, let's show you a picture of these. If we go back to the previous page, P3. So on the picture of the woman on page P3, you can see that they've depicted on this picture all these lymph nodes along the neck. And again, all of us at one time or another have felt enlarged lymph nodes. There are also a lot of lymph nodes in the axillary or armpit area. There are also a lot of lymph nodes along the vertebral column. There are also a lot of lymph nodes in the mesenteric area, around the intestinal area, and there are all these lymph nodes in the inguinal or groin area. Here you can see it says inguinal lymph nodes. So that's where we especially see a preponderance, a large number of lymph nodes. Now, on page P4, so we wrote on page P4, swelling of the lymph nodes. And the lymph nodes swell up, they enlarge when you're fighting an infection. Because not only are the bad guys, viruses and bacteria, removed by the lymph nodes, so they become more active, but this is also in the lymph nodes where we produce more lymphocytes. So we produce more additional lymphocytes in the lymph nodes. So when do you need to make more lymphocyte white blood cells? When you're fighting a bacterial or viral infection. So they become more active and enlarged. Now, it is very common that to palpate, what does palpate mean? Touch, to touch or feel, and that you should know that word. It is very common to palpate, to feel the cervical, axillary, and inguinal lymph nodes. So again, we've all at one time or another palpated or felt might have felt enlarged lymph nodes in our neck, probably when we're fighting. We got a sore throat. We're fighting a bacterial or viral and upper respiratory tract viral or bacterial infection. You can palpate the axillary and the inguinal. If somebody had a urinary tract infection, they might have enlarged inguinal lymph nodes in the groin area, because they're closer to where the infection would be. They do not palpate the vertebral and mesenteric. You'd say, why not? Because they're too deep to feel. You'd have to really stick your hand way down deep to feel those along the vertebral column. That would really, really hurt. You can't do it. So these cannot be palpated, but these can. And so if they're enlarged, that's indicating where either you have an infection or have recently had an infection, and the lymph nodes haven't yet returned back to their original size. So lymph nodes are one of the lymphatic organs. We're going to mention some others. And all the lymphatic organs do the same thing. They produce lymphocyte white blood cells, and they are involved in filtering out and phagocytizing bad guys, the lymphatic organs. Okay, let's talk about an organ that many of you have asked me about, that we have seen on the cat, but we hadn't yet talked about, and that's the spleen. Right, so we all had to see the spleen on the cat. The spleen is an organ in the upper left quadrant of the abdomen. In your upper right is the liver, the biggest organ in your body, if you don't count the skin. And on the upper left is the spleen. Now the spleen is made up of both white pulp tissue and red pulp tissue. Our first thought is, what's white pulp tissue? Well, we just told you, white pulp tissue is the name we give for lymphocytes and macrophages. So in the spleen, there are a lot of lymphocytes and macrophages. It is a lymphatic organ. It is an organ of the immune system. There's also red pulp tissue. What's red pulp tissue? Very large veins, large venous sinuses. We've learned that the word venous sinus or sinus refers to thin-walled veins. So there are many thin-walled veins in the spleen. In this picture here on the lower right, what it tries to convey is that this is a very low power magnification of spleen, of splenic tissue, of what the spleen looks like. So when we kind of cut open the spleen, there's this whitish area and red area. In your picture, the red appears black. All right? So the whitish area is the white pulp tissue, and the area that is shown in black on your picture are these venous sinuses, as it says right here, these big, thin-walled veins. So we already know what white pulp tissue is. It's macrophages and lymphocytes that are involved in filtering out and swallowing up bad guys, viruses and bacteria, and producing more additional lymphocytes. Now, what are these venous sinuses for? What are this red pulp tissue? And obviously we understand why it's called red, because there's a lot of blood in these veins. If you look on the next page, P5, so on page P5, so the red pulp tissue, the big veins, basically are involved in the following two things. They act as a blood reservoir. And so what's that? A reservoir is a storage area, a storage depot. So this is where a lot of blood is stored in these big veins inside the spleen. The context that some of you have kind of heard of this is there's an expression in English that somebody could die from a ruptured spleen. If somebody was in an auto accident and their spleen was crushed, they would have massive hemorrhaging or bleeding because there's all these thin-walled veins in the spleen that if they were crushed or hit right in the spleen, these veins would break open and they would have massive internal bleeding. So it acts as a storage area for storing blood. Also, it is in these large veins where there are macrophages that swallow up old, damaged erythrocytes. This is the same function that the liver also had. When we learned about the liver, one of the functions of the liver is that it breaks down old red blood cells. And we know the hemoglobin is converted into a chemical called bilirubin. Well, this also occurs in these big veins of the spleen, just as it occurs in the big veins of the liver. In both cases, they're called venous sinuses. Now, the spleen has other functions, including this function in a fetus, but I'm not going to test you on it. I put it in parentheses, so we're not going to worry about it. So, we've now learned that the spleen, like the lymph nodes, is a lymphatic organ, an organ of the immune system. Another organ of the immune system, of the lymphatic system, is the thymus. Again, it's not uncommon for people to call it the thymus gland, but it probably should not be called a gland. It should be just called the thymus. The thymus is located in your lower neck and extends in the mediastinum over the heart. Don't confuse the thymus with your thyroid gland. Your thyroid gland is higher up. It's on both sides. Your thyroid gland is on both sides of the thyroid cartilage of your larynx. All right, so that's where your thyroid is. The thymus is lower down and covers over your heart in the mediastinum area. Now, having said that, if you're thinking, well, like we didn't see that on the cat. No, we didn't see it on the cat. and you wouldn't see it on you. You'd say, well, why wouldn't I? Because I wrote it atrophies after puberty, and all of us are past puberty. By the age of 12, in humans, and whatever the equivalent puberty time is in a cat, the thymus degenerates, it shrivels up, it atrophies, it shrinks in size. So whatever the thymus was for, its function is over. So it ends by the time we're about 12 years of age. Now, what is the thymus for during childhood, since we have the thymus during childhood? The thymus is where one of the many types of lymphocytes originate. Now, I've been mentioning that we have lymphocyte white blood cells. I've said there are really 5 types of white blood cells. All of them are made in our bone marrow except for lymphocytes. They're made in our lymphatic organs. But in fact, there are multiple types of lymphocytes. There are T cells, or T lymphocytes, and B cells, or B lymphocytes. You may have learned something about this in biology. You will certainly hear much more about it in microbiology. The T lymphocytes, or T cells, are originally made in our thymus. And that's why they're called T cells, or T lymphocytes, is because they originate and originally are produced inside our thymus. But these T lymphocytes that are made in our thymus then leave the thymus, travel through the lymphatic system and blood system, and then migrate to the other lymphatic organs. So they migrate to the lymph nodes, they travel to the spleen, to the tonsils, to the appendix, to all these other lymphatic organs, so that as an adult, we have T lymphocytes and B lymphocytes in all of our lymphatic organs. But the original place where the T lymphocytes originally formed was in the thymus. So that process of producing these T lymphocytes occurs during childhood. By the time we're about 12 years of age, we reach puberty, our thymus is finished producing these T lymphocytes and it shrivels up. Okay, so it's no longer functional. All right, you'll hear a lot more about T cells, and there are even different subpopulations of T lymphocytes. There are helper T cells or CD4 cells, and cytotoxic T cells, CD8 cells. You'll hear all about these different categories, memory T cells, and helper T cells, and all kinds of other things in microbiology. All right, other organs of the lymphatic system or immune system are the tonsils. Well, we've just been tested on the tonsils. This includes the pharyngeal tonsil. You'll remember the pharyngeal tonsil is located on the posterior or back wall of the nasopharynx. When it's enlarged, it's called adenoid. All right, and it becomes, when it's becoming more active and fighting bad guys, just like lymph nodes enlarge, the tonsils enlarge. We have the palatine tonsils on the sides of our mouth, and they can become enlarged. That's called tonsillitis. And we have a lingual tonsil on the top back surface of our tongue. Lingual means tongue. We have pointed out previously that these form a ring around the mouth and nose area, as it were. That's kind of our defense system against the bad guys. So again, what's inside tonsils is, we could use the term white pulp tissue, macrophages and lymphocytes. And they produce more lymphocytes in these tonsils. We have also learned that in the wall of our intestine, the wall of our alimentary canal, in the submucosa layer, for example, there are these lymph nodules, collections of lymphocytes and macrophages, again, to defend us against bad guys. So we've got these parts of the lymphatic or immune system scattered all over our body. And finally, the appendix. Appendix, sometimes known as the tonsil of the abdomen, is attached to the cecum of the large intestine. And what is it involved in? It's white pulp tissue. It contains macrophages and lymphocytes. And it produces more lymphocytes. And it's involved in destroying bad guys. And just as lymph nodes can become enlarged when we're fighting an infection, and tonsils can become large when they're fighting an infection, the appendix can become large when it's fighting an infection. All right, so much for the lymphatic system. Again, functionally, we understand that when we get into function, that always takes us to the microscopic level, the cellular level. We're not really going to deal with that in this course, but you will, for those of you who have to take microbiology, you'll have an entire unit on immunology and the role of these different lymphocyte white blood cells and antibodies and so on. A few concepts, a few diseases and disorders of the lymphatic system I want to mention. Lymphangiitis. Itis means an inflammation. Ange means a vessel. We've heard of an angiogram where we inject a dye into a blood vessel. Lymphange means a lymphatic vessel. So an inflammation of a lymphatic vessel is called lymphangiitis. Lymphedema. What is that? Lymphedema is swelling, edema, or swelling because of some problem in the lymphatic vessels, a problem with the lymphatic vessels. I want to give you two examples of lymphedema. The first, elephantiasis, and the second, a radical mastectomy. And we have pictures of both of these on the next page, on P6. So on the top of P6, and if we look at this photograph on the top left, so our first thought is, what's that? This is the butt of somebody. This is their buttocks. This is his right leg. This is his left leg. This is from the back side. His left leg does not look good. This is called elephantiasis. Now, what is elephantiasis? Elephantiasis is a grotesque swelling or edema because of an obstruction, a blockage in the lymphatic vessels. What's creating the blockage that's stopping the flow of fluid through the lymphatic vessels? Haven't we learned that the lymphatic vessels return the fluid that squirts out of our bloodstream, returns it back to our bloodstream? So in this case, what's blocking those lymphatic vessels is the multiplication of a parasitic worm. So it's actually caused by a parasitic worm infection. The name of the worm is Wucheria bancrofti. I'm not testing you on it. It's a microfilario nematode, a roundworm that multiplies in the lymphatic vessels. It's not found in the United States. You're not going to run into elephantiasis in the United States. It is found in tropical zones of the world. When this worm enters the body, it lives and multiplies in the lymphatic vessels. Soon, in this particular guy, so there was all these worms that are living in the lymphatic vessels of his left leg. So they're clogging up the flow of fluid in the lymphatic vessels, preventing the fluid from going back to his bloodstream. So as the fluid squirts out of the blood vessels, the capillaries, it just collects and accumulates. Every day, more and more fluid is accumulating in those areas of his body where the lymphatic vessels are blocked, and so it's causing grotesque swelling. This is called elephantiasis. Now, of course, like all medical pictures, in medical books, they always show the absolute worst cases. The whole idea is to impress upon you what this is, and the way they can impress upon you is showing you a dramatic worst case, not a subtle case. There are medicines that people can take that would kill the worm, so really it shouldn't result in anything this grotesque, at least nowadays. Sometimes students will ask me, well, if this guy, looks like this, would, after they kill the worm with the medicine, would it return back to normal? The answer is no. It is so, the tissues and skin are so stretched. It's a little bit like somebody who loses a tremendous amount of weight, just has all this extra skin. It's just not going to return back to normal. So this would require a Beverly Hills plastic surgeon to repair. And there's, in those places of the world where we find elephantiasis, there's not a lot of Beverly Hills plastic surgeons. But anyhow, that's elephantiasis. A blockage of the lymphatic vessels leads to lymphedema. Now, another example I want to give is a radical mastectomy. up until fairly recently, when a woman had breast cancer, they used to remove the entire breast, including the underlying lymphatic vessels. That was called a radical mastectomy. The reason why they wanted to remove the breast and the underlying lymphatic vessels, is we know that cancer cells metastasize. That means they spread, they migrate through the lymphatic vessels. Some of you who might unfortunately know of somebody who has cancer, they will always talk about what involvement of the lymph nodes. How far has it spread in the lymphatic system to the different lymph nodes? So we know cancer cells migrate and spread through the lymphatic system. Furthermore, the lymphatic vessels of the two breasts are connected. So if there was cancer in one breast, the cancer cells can spread into the other breast, moving through these lymphatic vessels. So they used to remove the lymphatic vessels because they felt that if they didn't, there's probably cancerous cells there, and if they don't remove them, they would just spread, and the cancer would continue to proliferate and multiply and get worse. Today, they have greater confidence in the effectiveness of chemotherapy. So the chemotherapy that they use to treat breast cancer, they are more confident can control the breast cancer, so they usually don't have to do a full radical mastectomy. They do sometimes still do it in people who have inherited that BRCA gene, where we know there's a genetic component that greatly increases the risk of developing breast cancer. But most of the time, in most breast cancer, it's a pulpectomy. It's a very small part of the breast that's removed, and they try to leave and reconstruct the rest of it without removing the underlying lymphatic vessels. The point of this is that when in a radical mastectomy, when it would happen, and it still does happen occasionally today, because they're removing the underlying lymphatic vessels, so they're going to tend to get swelling in this area because fluid is still squirting out of the blood vessels, but you've removed the lymphatic vessels to carry that fluid away. It's not going to get as bad as elephantiasis because it's just a small number of vessels, and furthermore, gravity can cause the fluid to go down, and there are lymphatic vessels right below in the surrounding area that can pick up that fluid. But women who would have a radical mastectomy would still tend to have constant swelling, called lymphedema in that area. Back on the previous page, so we've spoken of lymphedema. The last thing I want to mention are autoimmune diseases. Now, we really don't know the cause of autoimmune diseases. In an autoimmune disease, the person's own immune system, their own lymphocyte, white blood cells, and antibodies attack their own body, their own cells of their own body. There's probably genetic factors. Whether it involves a disorder of the thymus, I'm not going to test you on that. That's a question mark. We don't know. We really just don't know the cause. But let's just remind ourselves of some examples of autoimmune diseases, and there are hundreds of them, but we'll just mention a few. Lupus. Lupus erythematosus is when the immune system attacks the skin and other organs of the body. Rheumatoid arthritis, where the immune system, the lymphocytes and antibodies, attack the synovial joints of the body. Rheumatic heart disease, where the immune system attacks the valves of the heart. Myasthenia gravis, where the immune system attacks the skeletal muscles. Multiple sclerosis, or MS, where the immune system attacks the nervous system. That's what MS is. Ulcerative colitis, where the immune system attacks the large intestine, the colon. Juvenile onset diabetes, where the immune system attacks the pancreatic islets, destroying the beta cells that produce insulin in the pancreatic islets, or islets of Langerhans. These are just some of the autoimmune diseases. And obviously some of these we have mentioned over the course of this semester.